Hello, and thank you for joining today's webinar. We'll get started in just a few minutes. Thank you for joining us today. We'll get started in just a few minutes. Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is eligible for 1 contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Centers Commission on Accreditation. The planning committee members and speakers have disclosed no relevant financial relationships. To receive contact hours for this NCPD session, participants are required to attend the webinar and log into our learning management system to complete an evaluation form. Information on how to access this will be emailed to all attendees approximately 1 week after the webinar. This webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following the presentation, if we have time, we will have a question and answer session. You'll see on your Zoom webinar control panel that you can send a message through the Q&A feature. This is where you can type in any question you'd like to pose to the presenters. Be sure to hit send so the message makes it to us. Please use the Q&A feature for questions and the chat feature to interact with other participants. Before we introduce our speakers, we would like to remind our participants today that Sigma is politically neutral. With that being said, we'd like to thank our speakers for sharing their expertise with us today. Our speakers today are Enrique Castro Sanchez, Roya Hagari Vijay. I'm saying her last name wrong, so Roya, I deeply apologize. So we'll just call her Roya from now on. Brooke Newman and Michael Polachek. Enrique is an associate professor in infection prevention at University of West London and associated lecturer at planetary health at UOC Spain. His research focuses on how behaviors, technology, and social determinants influence infection prevention and antimicrobial use. He has worked in infectious disease and tropical diseases, infection prevention, and advanced nurse practice in HIV and AIDS. Enrique has served as a consultant on infection prevention for the World Health Organization and is editor-in-chief of Infection Ecology and Epidemiology Journal. Roya is a professor of nursing and is an active member of the Registered Nurses Association of Ontario's Rainbow Nursing Interest Group. Roya's program of research is focused on the experiences of individuals at the intersection of identities. Brooke Newman is a doctor in nursing practice, administrative, organizational, and global health systems executive leadership. She bridged her master's in science of nursing at Capella University. Brooke graduated in May 2022 and received Magna Cum Laude 4.0 GPA graduate school accolades. Brooke is Global Health Impact Investing founder and Chief Executive Officer, CEO, a public benefit corporation. She is also A to Z's advisor to funds for healthcare artificial intelligence startups. She serves on multiple boards such as Sigma Theta Tau International and is chair of Omega Gamma's Leadership and Succession Planning Committee. And Michael is a certified nurse in psychiatric mental health and nursing professional development specialist and has presented at state, national, and international conferences on mental health topics. He has served on the board of directors of the American Foundation for Suicide Prevention Oregon chapter, the National and State American Psychiatric Nurses Association, and the Mid-Valley Suicide Prevention Coalition Steering Committee. His focus is on community development and policy development in suicide prevention and trauma-informed science. Wow, with all of those great accolades, I want to welcome all of you, and we'll turn it over to our speakers today.
Okay, thank you ever so much for the opportunity to be talking to you today about the policymaking, health reform, activism, engagement that nurses can have. These are some of the learning outcomes of the session for today. You'll be able at the end of it to apply translation of research to nursing practices. You will be able to synthesize American Association of Colleges of Nursing Essentials, focus on advocacy. And finally, you'll be able to evaluate the World Health Organization's State of the World report related to nurses' policy participation. So focusing on my presentation, thinking about planetary challenges, political skills, and nursing practice, I'll try to convince you that this is a space where nurses have got much to do, and sadly, perhaps until now, we haven't done enough. Obviously, I would like to make very clear that this presentation is just my opinion and presents my views and not of any of my employers or organizations I'm affiliated with. University of West London, NHS England, Imperial College, Primary Care, University of Alberta, and Shifa Al-Tamir Milad University. You've got there also the disclosure of interests of my colleagues and co-presenters. So often you'll hear that nurses we're not at the table, we don't have a seat at the table where decisions are made. And I wonder whether we may be focusing on just improvements and advances for our own profession, but we may be forgetting that there are other topics and other areas such as social justice and advance, where we could have a voice and we could have a seat at that table. And I think that the planetary challenges that we've had recently offer a really painful but useful stress test for the different clinical and social and cultural and economic models. These are all opportunities, I believe, to reflect upon what we need to do to make things better. So these are some of the topics, these are some of these planetary challenges that the global society faces. Anything from inequity on the top left, you've got a picture of those favelas side by side with high rise buildings. You have got drug resistance infections. You have got at the bottom up right at the center, the climate crisis. And the bottom right, you have got our productive models of how we consume, how we produce food. And obviously, you've seen that the panel today is full of economic migrants or migrants. At the top right, we've got mass migrations and humanity movements and displacement. So these are all topics of important global topics, highlighted some of them by the World Health Organization as areas where, we really need to focus our global thinking to try to address the challenges that they present. In my opinion, perhaps, these global threats are not a cause, but a consequence, the symptoms of a much more global malaise. And I wonder, I don't think it would be a surprise for any of you, for any of us, that nursing practice aims to ensure equality. If you trained in the 80s, more recently, we're focusing on equity and inequity. But even then, I think that what we need to focus perhaps is in the way in which our society is built from the economic and social and cultural point of view, and how some voices are left unheard, and how we as nurses thinking about the holistic biopsychosocial domain that we aspire to have, we really need to consider the impact that this productive model can have in the life and welfare of people. Some of the solutions proposed for these planetary challenges reflect this sort of planetary perspective. And the idea of public health and global health and international health has really been replaced by planetary health, where the connection between the human and the social and the economic domains is made. And it's not just the connection or interconnection, but also the interdependence. So some of the issues that I've highlighted up until now, they may reflect problems related to health, but the source of the problems has got nothing to do with health, and it may have everything to do with politics and policy and policy making. And thinking about that picture on the right about the planetary health education framework, you can say not just the interconnection within nature, but you can see that equity and social justice as one of the pillars. And if you're thinking, well, those have got absolutely nothing to do with my nursing practice, or I cannot see how those will have anything to do with my nursing practice, we must remember that we have got a responsibility from an ethical, but also a regulatory point of view. Many of the current codes of practice, from the International Council of Nurses to your own National Council Code of Practice and Ethics, really underscore the responsibility that we've got as nurses, not just to focus on the clinical aspect on the patient, but also about the causes of the causes. What is it that is making my patient sick? And what can I do at all levels to prevent that from happening to others? And in order to be effective operators to have such impact, we really need to collaborate with national and international nursing organizations and other organizations on policies and legislation which addresses socioeconomic determinants of health, cultural, commercial determinants of health, obviously closely linked to this idea of socioeconomic determinants, we find equity and social justice. So this is right at the core of nursing practice. And finally, we really need to think about how we make sure that this global home that we share with many other global citizens and animals and the environment, the planet, is protected from the impact of the climate crisis. So to be an effective operator within these domains, we really need to demonstrate political competencies. So this is quite different to partisanship. So you can develop a very effective political career without ever touching anything related to a political party. But these political competencies are vital for social and professional advance. And you've got there on the right a few concepts, anything from political literacy, having the skills to make sense of the policymaking journey, being an effective policymaker and influencer, being politically astute, and being an advocate. You have got a whole range of opportunities to influence and social life and social decision-making as policy activists, within the political process, as lobbyists, and so on. And you can see the examples of this close political involvement. And you may remember the Nursing Now campaign, which was launched by a member of parliament or ex-member of parliament in the UK, and achieved the political support and the endorsement of key figures around the world. You've got there Elizabeth Arrow from the World Health Organization, and so on and so forth. So this political influence, this political astuteness, you can see how it's not disconnected at all from progress in nursing. And these are some of the opportunities for you to gain and demonstrate skills such as health diplomacy with Sigma, and some of the continuous professional development opportunities like the virtual mini academy, focus on advocacy or health equity. You got some courses such as the Advocacy certificate program, and finally opportunities to attend United Nations meetings and so on. So these are all opportunities for us to develop our skills. Thank you ever so much for the time, and I pass it on to my colleague Roya now.
Thank you, Dr. Castro-Sanchez. Hello, everyone. My name is Dr. Roya Hagiri, and following Dr. Castro-Sanchez's, I would like to share an example of the important role of nurses with a specific population. Before I start, I would like to acknowledge the land from which I join you today. Toronto, or Toronto, the more colonized name, is still home to many Indigenous people from across their island. And as a first-generation settler, I'm grateful to have the opportunity to work, live, grow, and even have a family of my own in the communities that have grown the treaty lands of the Mississaugas. I acknowledge that we're all treaty people and accept our responsibility to honor all relations. Briefly drawing from the literature, over the past several decades, some nurses with social and mental health care providers, in collaboration with migrants, LGBTQI+ people, or those at the intersection of identities, have strived in allyship and advocacy in advancing safe and affirming spaces for 2S/LGBTQIA+ migrants. Despite the work of nurses and other colleagues in education, practice, and policy, even in a Canadian context, there has been evidences of heterosis normativity and non-affirming care and racism in healthcare practices with marginalized people, such as LGBTQI migrants. Most importantly, 2S LGBTQI+ people are a subset of migrants who have had another layer of challenges in navigating healthcare services that require trauma and violence-informed care. So I share with you a study, and very briefly, and the aim of that study was understanding experiences of 2S/LGBTQI+ migrants with nurses and other healthcare professionals in Canada. Two overarching areas of intersecting experiences were identified. I want to emphasize how much and how frequent the participants highlighted the supportive experiences in encountering with nurses. However, they also shared some of their interwoven challenges. On one hand, informants shared affirming practices in which nurses understood their intersecting experiences of sexual orientation, gender identity and expression, their experiences, migration from one country to another transition country, their experiences as an immigrant with a different religion, their ethnicity, their experience of racism and mental health, and participants highly acknowledge the work of these nurses. On the other hand, there were interwoven experiences of challenges, and these included their unwanted visibility in the healthcare system, hearing their dead name, being misgendered, experiences of structural, social, and cultural stigma. They spoke about intrusive heterocisnormative questions that was asked by their nurses that were extremely traumatic for them. And they also shared the limited affirming spaces for their intersecting identities, as identifying being as racialized, as a migrant, as a 2S/LGBTQI+ person. So I asked the informants or the participants, what supportive care can nurses provide for 2S/LGBTQI+A migrants? I will share a summary of implications in 2 areas of policy and education. The reason informants asked us to lobby for mental health support was due to the past and recurrent experiences of discrimination and stigma, challenges in accessing and affirming migrant 2S/LGBTQI+ mental health care professionals, and the financial costs of these services. Many participants suggested that intentional inclusion of migrant 2S/LGBTQIA+ people as nurses and healthcare providers may mitigate these heterocisnormative views and provide comfort to the racialized 2S/LGBTQI+ migrants accessing healthcare services. One participant stated, as a person of color, as an LGBTQ+ person, when you walk into somewhere, you make a mental note of how many colored people are in a room. Number one thing that makes you become comfortable is because it's diverse. Another one is knowing that there are actual LGBTQ+ folks here who have lived experiences as a migrant. I will conclude with the following. Some of the participants also identified as migrant 2S/LGBTQI+ nurses. These nurses underscored the invisibility of the political and policy work of nurses to address their intersecting healthcare needs as migrants, racialized, and 2S/LGBTQIA+ person. I must add that in 2021, Registered Nurses Association of Ontario published their first best practice guideline, which is called Promoting 2S/LGBTQI Health Equity, but not all nurses are aware of this work or other policy actions to improve healthcare for diverse populations. Majority of participants in this study highlighted that they felt invisible at a policy and political level to receive meaningful support for their healthcare needs. Some of the participants who were not nurses, but identified as 2S/LGBTQI+ migrants, weren't even aware that nurses can advocate for them at a policy level. At this time, I'd like to thank you for allowing me to share a glimpse of this research as an example, and I will pass it on to Dr. Newman, who will discuss the importance of nurses' seat at the global policy making table. Thank you.
Thank you, Dr. Raya. Hello, everyone. I hope today's session helps you to reflect on how you can become more involved in healthcare policymaking, as I illustrate today how advocacy should be essential nursing practice, irrelevant of years of practice, gender, or professional role. Slide, please. Today, we will discuss what it means to have a seat at the table, be advocates, and why and how the WHO's 2021 report is relevant to nurses' policymaking. I will also discuss how nurses' participation in legislative policymaking connects, develops, and empowers nurse leaders to transform global healthcare. Slide. A seat at the table refers to your involvement in policy decision-making, and it should be applied to the social and/or economic governance. This is where the process problem lies, and I will address how nurses can become more involved in legislative policymaking. Slide. So let's take a deeper dive into how we can be involved in healthcare policy governance and have a seat at the table, starting with dialogue, the early stages of policymaking. And if you don't have a seat at the table, I'd say bring a folding chair, which is also from Shirley Chisholm. There are some alarming statistics that illustrate that as a profession, we really do not have a seat at the global table. The global studies illustrate that currently less than 30% of the nursing profession is involved, which is not ideal to say the least. One way that you can become involved is by conversing with government officials who currently make most of healthcare legislative decisions. You can also become involved in your local or national professional nursing associations. Slide, please. Nursing practice, regardless of years of experience, role, gender, etc., should include health policy advocacy, a policymaking activity locally, nationally, and internationally. In fact, I believe that all nursing programs should include this in their curricula as an essential of nursing practice. Slide, please. So why are there not more coordinated actions involving nurses in health policymaking? The research shows that we should be. The WHO's 2021 report also illustrates that investments in nursing, such as increasing the scope of practice, will motivate the workforce, and this certainly pertains to our involvement in health policymaking, as well as social and economic governance. Slide, please. Internal policy in your workplace and state of or federal policymaking, such as advocating for staff ratio legislation, certainly fall into our scope of nursing practice. Staffing requirements is just one example of a global nursing problem and what you can do to become more involved in or advocate for during any part of legislative process. Slide, please. Next slide. I'm looking forward to your input as I imagine one of your personal or professional key performance indicators relates to the workforce and investing in the nursing profession, as well as vulnerable patient communities. Some reflective questions to ask yourself and colleagues are, so why are nurses globally marginalized in policy decision-making? Why are we not dialoguing with government officials as the most trusted profession? And why are other industries not investing in our clinical expertise input? Next slide, please. The current state, according to Waddell's 2020 research, found that nurse leaders should educate, motivate, and mobilize clinicians' expertise and favorable public perception to influence political governance and interprofessional processes, improving universal health system governance. The implications are to ensure your seat at the table as the most trusted profession, optimize the AACN advocacy essentials, improve nursing advocacy practices, and follow the global health recommendations outlined by the WHO's State of the World Nursing Report. Future state is for nurses' participation in legislative policymaking to improve patient and population health outcomes and disrupt the process problem, which is marginalization of nurses' participation in policymaking, such as a policy forum where clinicians in all practice settings dialogue with government officials. The interprofessional forums have been piloted successfully. I encourage you to ask questions about these next steps to become more involved. I'd like to turn it over to Dr. Paula Trek, the Nurse Policy Entrepreneur Cafe.
Thank you, Dr. Newman, and thank you, my panel colleagues. We really appreciated the time we got to spend with each other preparing for this presentation. I also appreciate Sigma staff for quickly responding to the members' expressed interest in this topic. Slide. As a great-grandfather and human, I'm particularly interested in creating a safe and supportive environment that empowers everyone to live the life that they desire. As a psychiatric mental health nurse, my approach to achieving that goal is related to suicide prevention and raising awareness for trauma-informed science. This is where the role of the policy entrepreneur comes into picture. Now you see When we think about nurses, we may not always think about the work that we have done as a profession. Florence Nightingale was a policy entrepreneur. She saw a need, she saw a problem, she understood what the political climate was so she could navigate within that successfully. She created teams, she provided the leadership for that. And as a result, she was influential in creating policy that changed the world. I see gaps that need to be resolved. And unless we do something different, nothing's going to change as far as healthcare is concerned. Unfortunately, I found myself unprepared to perform as a nurse policy entrepreneur. Nurses are the most trusted of all professions without exception. Yet we're not prepared and are not necessarily respected as policy reformers or thought leaders. There are a number of articles and research conducted on this, but I was curious. So my approach was to ask the nurses themselves, have a conversation about this, which led to the cafe. Nurses are excellent at clinical practice, but more so, nurses are excellent at empowering people and even empowering their family members. Why can't we be accepted as excellent at empowering community and society? That should be part of what we do. There are a number of reasons why nurses must, not should, become full partners and thought leaders. But a significant reason, I think, is because we're not prepared and we don't act. My contribution to this discussion is about action and the role of the nurse policy entrepreneur. Now, think of the entrepreneur as someone who sees the needs, creates a response or intervention, and drives that towards the goal. It's important to recognize that entrepreneurs are internally motivated. They're not externally motivated. There's something inside that drives them, a hot button. Mine's that whenever I think of suicide, I see faces, I see people, and that's what drives me. I don't see numbers, I don't see statistics. I see individuals struggling, and that's what drives me. Slide. There's a little difference between politics and policy. Policy is simply a statement. Politics is a little deeper and it's more dynamic. Of course, there's the politicians who, as Dr. Castro Sanchez mentioned, is much more than just a political figure. There are a lot of ways that we can impact and influence politics. It's also, politics really talks about how people interact with one another to make decisions. Slide. This is an important piece that I recognized soon after becoming involved in policy development. If a nurse is part of an association, that association typically is organized by the IRS as a nonprofit, and they have very strict rules about how you can conduct yourself. So as a member of an association, if you imply or state that you are representing that association, you might expose the association to IRS sanctions. And the worst case would be that they violate this rule and they'd have to pay back taxes for all the years that they were engaged. So I was encouraged to understand this significant point about contributing as a policy maker and decision maker. Now, there are organizations like the ANA has a PAC. That's what they do. They specifically work within the political system perfectly fine because they're organized that way. Slide. So how do you get around that? Well, if you testify, you talk with someone, anybody about it, just make sure that you're speaking as an individual. You're not representing anybody, just like we do with this any kind of presentation. Same thing. You're speaking on your own behalf, your own experience. Slide. One more slide. See if there we go. So apparently, well, not apparently, but according to these data, there's about 5.25 million active nurses. So that's where we could start from. That's our pool to impact policy and healthcare reform. Slide. According to the Nurses on Board Coalition, Storm Young, I'm not sure of her role there, but she spoke to me about their data that they've collected. Out of that 5.25 million nurses, 23,000 nurses have been registered with the coalition to contribute as members on boards. So you can see we haven't touched the surface on contributing. We're getting farther, but we still have a lot of work to do. Slide. Slide. Here's some examples. You don't necessarily have to serve on a hospital board in order to contribute. Healthcare is a broad scope. The scope is huge. We know that in suicide prevention, folks that are considering suicide or made that decision, they often take their animals to the animal shelter. So why can't we create a policy that encourages or enables employees of that shelter to be trained to identify someone at risk? So that may not seem like a healthcare role, but you could be on a board of directors for that and impact healthcare. So there's a lot of different ways that you can contribute. It doesn't necessarily have to be on a specific hospital board of directors to change policy. Slide. So why aren't we on the table? Why aren't we part of that? It's a good question. Slide. That's a strange slide to put there, but let's talk about the cafe. The idea behind a cafe is to create a conversation and share learning, share understanding. It's a brilliant way to gain understanding, a deeper understanding, using deep democracy, really where everybody has the same voice. Slide. We approached it like this. I invited initially through 3 different nursing associations on their membership boards, on the SIGMA, on the American Psychiatric Nurses Association, and the Association for Nursing Professional Development. I asked people if they were interested in this, and so everybody that responded to me were invited to a Zoom meeting. We broke it into 3 breakout rooms, and each we had 3 questions. So we'd have 15 minutes for one question, and then we would break up into the next question. So we had this rotation. It took about an hour or so, and then we came back together, and we shared our discussion, what we discovered as a result of those questions in a whole group. Slide. Here are the 3 questions. Now we ended up having 4 cafes, 3 initial cafes with these questions, and then we've had 1 cafe in the past 2 months as a follow-up to this to really create more of a strategy on what to do. This first cafe was simply curiosity and discovery. We were not looking at any issues and solutions. Slide. This is what we came up with. Using an application, a virtual application, Miro, we were able to collaborate and at the same time virtually construct this affinity diagram. We're also working on this SWOT chart on the bottom. So this is an ongoing project that emerged out of the cafe, to where people can get on at 2 in the morning and look at this board and add things, rearrange things, create topics. So you can see in the black, those are our themes. I don't want to get into big detail on what this says, but the idea is that the cafe was able to, I feel like, bring people to the table and discuss what are some enhancers, what are some barriers, what would it look like if we were to become more engaged, how can we improve? So ideally, the results of this cafe, or the series of cafes, would be to create maybe a briefing paper or a white paper discussing our findings, and then offering some suggestions to nursing associations of how they might create maybe toolbox or maybe a little bit more focused support for nurses as they want to become more engaged. Because what we found is nurses aren't engaged not because they don't want to be, they're not necessarily sure what to do, or there's other barriers. If you're young, you have early in a relationship, you have kids, who's going to watch the kids? How do you deal with that lack of capacity? So we found that a lot of the folks that were engaged in the cafe were older. They had already been past some of that, and they had more capacity, more time to contribute to that. So one of the questions is, how do we engage younger, newer nurses? How do we support them to become more involved? So that's the results of the cafe. It's an ongoing project. If anybody's interested, then let me go. Slide. We had the first cafe, which is assessment. The second cafe, we've had 1. And we continue to have, as long as there's interest, I'll continue to support this project for the future. Slide. And those are the references for our all 4 of us. Thank you. Slide. Oh, we like our references. I think this is a question time.
Yes, this has been wonderful. Thank you all for sharing such great information from your different lenses and viewpoints in which you see nursing in the policy realm. We've had such great interaction in the chat and in the Q&A feature, so I want to thank you for engaging in that way. A couple things that I did want to point out while we're waiting for some questions to come in is it looks like Brooke wants to encourage participants to review the 2020 through 2020 or 2030 Future of Nursing report, as it emphasizes the need for nurses to become involved in policymaking to achieve health in all policies. I agree, Brooke, and we did actually have a webinar, I believe it was earlier this year, about the report. So I would highly recommend that you look for that in the Sigma repository. And then, of course, Enrique shared a link for a paper from Health in All Policies to Health for All Policies. And I think that's a great paper for you to reference as well. So it looks like we do have one question. To bring nurses to the policy limelight, a lot of stereotypes exist in which the vibrant younger one are being suppressed as a result of age, years of practice, or newness to the profession, race, gender, etc. How can this be curbed to get nurses to the policy table, not minding who is involved? So I know, Michael, you had briefly touched on the younger nurse. Do you want to maybe kick it off? Do you have anything that would answer this question?
Sure. I became a nurse when I was 50. So I'm a relatively new nurse. And I got to tell you, I experienced some of the things that a younger person might have experienced as a new nurse. In fact, I continue to periodically get I feel a little edge from nurses that have been nurses for 30, 40 years. And it's a cultural thing, and I'm not sure how to address it specifically, except when I talk about trauma-informed science, we must recognize that people become activated. Our bodies respond to a sense of injustice or a sense of when they're not part of a group, when they're excluded in any kind, our body responds, and it's really difficult to get a collaborative relationship, which is what nurses are good at, relationships. It's really difficult to do that. It's a shame that within the profession, we should be the best at collaborating, the best at inclusion, and we still struggle with that as a profession. So it's something to address and constantly address, because it's easy to slip out of that.
Wonderful. Thank you, Michael. Do any of the other panelists want to address that?
I'd like to say something quickly. I definitely suggest and promote that nursing programs, regardless of whether it be baccalaureate or above, do include our involvement in the curricula. I do think, for example, when you write a care plan with patient care, we have that skill set, whether you've been practicing for 1 year, 10 years, 20 years, and you can apply it to dialoguing with government officials. What are the needs? What are the outcomes? I think that we definitely have that skill set.
Wonderful. Thank you, Brooke. Go ahead, Enrique.
I was just sort of wondering that, from a leadership point of view, maybe those nurses who are already in positions where they can influence policy and they're engaging in advocacy and activism, perhaps we should be thinking about succession and how we can engage with these newer, younger, any other, nurse interested in this domain, and to try to make sure that, we nurture others who may be interested. So it may be that we have a responsibility to make sure that happens. I suppose I'm sort of blaming all of us, kind of pointing the finger to all of us. But yeah.
Wonderful, thank you. And to coattail off of that question, what about best practices for nurse educators, tried and true learning activities in policy, or any toolkits to teach this topic? Do any of you know of any good tactics for the nurse educator?
If I may, thank you. Linda. I think that's an excellent question. And also, we need to think about how we are prepared. We can't just make an assumption that, for example, somebody who's an educator, like a nurse educator or professor, knows everything about policy making. So finding strategies of finding resources and finding mentorship, even for those who are in educator positions, in professors or instructors, I think that is crucial and important. I also wanted to just add in something that we were discussing our previous question, and this kind of ties in with Mariam's question on what would be the first step for someone to stand up in policymaking. I'm kind of just going to give them together. I think it's really important and crucial for us to be engaged in this discussion at baccalaureate, master's, or PhD. But also, we can't forget our nurses who are diploma prepared. In Canada, we have a huge number of nurses who are diploma prepared, and they do such great work. They have great responsibility. They're knowledgeable. So creating these and threading some of these also in their education, I think it creates that avenue and voice where they're in practice, so they can be involved in some of those policy making. Enrique said, we do the point a finger, but every time we point a finger, 3 others are pointing back at us. So we can think about how we actually are, as he said, how we're actually fostering that experience for our students. For example, do we have, policy, or do we have nursing organizations within our different countries, different states, where we can create those spaces? Are we encouraging our students to, even from the very beginning, to be involved in those conferences? And are there, resources available for them to come in and attend and be engaged in discussions? So I think that's all really important. Even as those first step, I have to say English is my 4th language. And I was very, very nervous, even when I was thinking about, I have to come and be involved in policy, and just having that one professor and one educator who just gives you the little push of, hey, you want to just come with me? We are going, there's a session, for example, our nurse association's coming up, and then being engaged in that discussion. And again, fostering in different ways. It's sometimes hard to say a cookie cutting approach may not be applicable to everybody in their different states, in different countries, in different provinces, but really finding those mentors, collaborating. Sigma has created the sessions, maybe making connections here, and connecting with the rest to be continuing this engagement. Sorry, very long answer.
I love it. Yes. Thank you for that. Michael, did you want to add on?
Yeah, I love that. And we've had such a good chat, the 4 of us, preparing for this. We all come from different places. It's just been, I love discussion because I always learn something. One thing that I recognized immediately was I didn't know what I was doing. And so I created a personal professional development strategy, a plan. What was I lacking? So I kind of took assessment of what I was lacking, and I knew nothing about policy. I knew nothing about politics. So I started looking for people who seemed to. And then I started looking for the skill set. And that's one of the categories that we discovered in the cafe, which is pretty obvious. What's the skill set? Well, do you know, if you're going to be part of a board, which could be any board, it could be the school board, it could be the symphony board, doesn't matter. Learn how to act on a board. Learn the process of participating as a board member effectively. And so how do you do that? Well, Toastmasters is a great way to learn to talk. Being active in your nursing association is a great way to learn to connect with one another. Taking it seriously when you go to those committee meetings in your organization, really focus on how do you become an effective shared decision maker? What are the tools? What are the things that you're lacking? So I would suggest, I totally agree, find somebody who's good at this. That's what people in sports do. They find somebody, they emulate them. And the other thing is identify what you're lacking. So I think out of the cafe, what we'd like to do is create maybe a skill set, and there probably already exists. I don't know. We don't know that. So I'd love to have more information on something like that.
Wonderful. Thank you so much, Michael, for sharing that piece. And thank you all for your honesty and your vulnerability, because I know it's hard sometimes to share, especially with this large group that we have today, things like I was nervous because this isn't my primary language, or like Michael shared, coming as a later career nurse, I would say, joining the profession later on. So I want to ask the panelists this question that came through in regards to how do we engage those individuals that quote unquote say they're too busy, or they have other priorities? How can we encourage them to get involved in this space as a nurse, or how can we help them see the value in getting involved in this space and putting the excuse of I'm too busy to the side to be involved in quote unquote one more thing?
I think that is certainly a common occurrence, but I would like to emphasize policymaking has several cycles, and I think that a lot of nurses might think it involves voting, going to the Capitol Hill, and all those things. That is just a part of the cycle, and it's cyclical. But the first part is dialogue and analyzing the research relevant to this. And I think you can do that in a pretty short period of time, and maybe start there, just looking at the different research, analyzing the needs, and starting those conversations. That's actually a policy making activity. So I encourage you to start there.
I think that it may also be quite important for us to make a difference between the individuals and their profession and their professional structures. I mean, in many countries around the world that I know of, nursing organizations do not have, policy making, policy influence, lobbying, and even advocacy units or people employed within the organization to scan the landscape and pay attention to sort of the policy movements that may have an impact on the profession. So it is true that I think it's legitimate if people don't have time, energy, or it's not a priority to focus on this domain of nursing practice. As long as someone is, carrying that torch, that's fine for me. But I'm quite anxious about, the lack of structures in many countries to influence government policies that can impact on the profession and society and health. And that worries me more, because I'm thinking, well, other professions are really proficient at these sort of like landscape scanning and influencing and sort of, gaining support. And there is a comment from Sarah Bohacek in the Q&A about, how our voice is not, recognized and so on. So I think it would be important to remember the two kind of levels, and the more macro and the more micro.
Michael, did you want to share anything in that regard?
Yeah, when I first started thinking about this, I co-authored a paper with Dr. Jake Craveston about getting on board. And what we discovered as we dug into this is that part of this, the problem, and I'm being vulnerable here, part of the problem is nursing culture. We started out as a handmaiden of the physician, and if you follow the pathway of nursing as a vocation, I still think that people struggle with being a nurse and a hourly paid employee versus a profession. And I think some of that can be resolved at the upper levels of organizations. Magnet, I think, is a great opportunity to create an environment to where the nurse is seen as a profession. One of the exemplars that I wrote on our Magnet application was the engaging the community in suicide prevention. And so showing how the hospital can participate as changing the climate in the community through creating policy and empowering the layperson to become part of the suicide prevention team. So I think organizationally and executive leadership could take this on and start supporting nurses to become part of the decision-making process.
Thank you, Michael. And if I may ask as well and answer as well, I wanted to actually go back to the question that one of our colleagues had. I'm just going to clarify it from Sarah. One of the questions was, there's an overriding belief that nurses without a PhD are not qualified to sit at a table. Does anyone have suggestions on how to help change a political opinion on the validity of nurses regardless of education? I think that's an excellent question. Thank you for asking this question. And I'm going to give you an example of what we are doing. Well, I can't claim this, but in Ontario, Registered Nurse Association of Ontario, they actually have interest groups, and there's various interest groups. There's research interest group, there is, older adults interest group. There's just, if you go online, you can see different interest groups. And with each of these interest groups, there is different roles. And one of their roles as well is to have representative from students to be involved, and we encourage our students to come in, even undergrad, to come in their education, to come in and be involved, taking one of those positions and be involved in these discussions. So this is something that I've seen within RNAO interest groups that has been successful. There is other ways. So again, my apologies. I'm not sure where everyone's coming from, but from the Canadian context, there is, Canadian Nursing Students Association, where students from different schools come together from different programs. They're looking at even when we talked about, for example, again, truth and reconciliation and what's going on, what has happened and how we can make our program more political in a way. We had students who come in and they put priority forward and were engaged with it in the discussion. So again, I'm not claiming that it was me who did it, but it was like something that we found helpful. And I've seen, and that's how I started, even as a student, to just get, my hands and feet perhaps wet and getting into the experience of what, how are those policies formed? How are those action calls are put up? Who works on them, right? Like, what are those strategies and how we can get it more engaged? So thank you.
Wonderful. This has been such great dialogue. And to be honest, I'm having a hard time keeping up with everything that's going on in the chat and the Q&A, and I just love it. We have a few minutes left, and it looks like people are continuing to talk about legislators and how they know little about nursing and what's really going on. And so becoming involved in state boards of nursing is an easy way if you're in a location that has a state board. I do know that we have a variety of countries on the call today. So not all have state boards of nursing like we have in the United States. Many regulations are driven by what their accrediting facility is. And of course, we also know that, excuse me, that internationally it looks a little bit different. A question to the group is it nurses initiated multidisciplinary decision-making group or a platform available internationally? So I'm not quite sure what that question means, but what do you think about policy internationally, and what does that look like to move the needle for nurses worldwide? Any of you can take a try at that question?
I know Sigma UN representatives, we have some going to the United Nations advocating on behalf of the United Nations Sustainable Development Goals, which I think that's an amazing step forward. So I'll just add that in. And that's some of Sigma's work.
Wonderful. Thank you, Brooke. And I believe we have applications open for UN reps. Is that right, Megan?
Why, yes, Linda, it is. We have applications open till November 1st for liaisons to the United Nations and youth representatives to the United Nations at sigmanursing.org.
Wonderful. Thank you. And Roya, were you going to say something?
I just was going to add that as we are very mindful that we do come from a position of privilege and where we are and where we're situated. And there are countries where their nurses are not able to be engaged in policy work the way we have been. But if we can, from myself speaking, speaking from a position of privilege, if I can hear those voices and share what's occurring, for example, some of the hideous, traumatic experience of people who identify as LGBTQI plus people in countries where there's no human rights for them. If nurses there can't speak, again, rather than me pointing, saying, well, how come, and at one point I was like, well, how come nurses are not speaking up for, what's happening to these individuals? Well, okay, so what can I do? The three fingers I was pointing back to me, right? Is there something that I can do to be engaged in policy and policy making? And even from here, at least when they come here, what support do we have in place? Do we just say, oh, you're safe here? And what does a safe haven looks like, per se, right? So being mindful that, I know I acknowledge that some of what we share and how we are getting engaged may come from a position of privilege.
Thank you, Roya, for that. Yes, I think a position of privilege is sometimes something that we don't take into consideration. So thank you for sharing that. We did put the reference page back up as we had someone wanting to see the World Health Organization references. And then we do have a question directed here for Michael. Michael, did you see the question in the chat?
It went by really fast. I saw primary and then.
I'll read it to you. How about that?
Sure.
I am a pediatric primary care nurse in the United States. Many children in the USA are experiencing huge declines in mental health. I have heard of social prescribing programs such as a mental health treatment, often used in the UK and Europe. Do you have any experience initiating these types of community health programs? If so, what do you think most Americans would think about it?
Right off the bat, I'd say that people do not understand the impact of trauma. And trauma is such a broad topic. You could have traumatic grief, you could have adverse childhood experiences, you could be in a flood, you can have, there are so many ways that our bodies and our minds, because they're connected, we're connected. In fact, if your mind isn't healthy, it's big chance that your body's not going to be healthy. So I think awareness on trauma-informed science is critical. And especially as a clinician, how in the world can you take care of somebody's body if you do not understand, if you're not aware of the trauma that they've experienced, regardless of what you think about it? I think trauma-informed science is the foundation for our society. And I think the more that we get that out and make people aware of that, especially clinicians, I think that will cover a lot.
Wonderful. Thank you. So we have just a few minutes left. I'm going to open it up to the panelists. Do you have a few parting words before I close us out today?
I think we'd like to move this forward potentially, and we'd like to further these discussions. That's what I'd like to finish. And also thank you for everyone joining.
I personally just encourage everybody to be creative in how we let society know about our views. It doesn't have to be a very formal pathway. A letter in a newspaper sort of highlighting the impact of a government decision could be something very powerful, and many other opportunities. So it doesn't just have to be, people in a suit and sort of like a formal channel. But thank you all for being here and the opportunity. Superb.
Also echo what Brooke and Enrique said. It's been a pleasure. It's been great working with the team. And thank you, Linda and Megan and everybody at Stigma for making this happen. Thank you all for making time to be here. We know how busy life is and everything going on. So thank you.
Thank you, folks at Sigma. This is powerful. I hope this is a beginning of something, and I hope we continue on to connect with other people. That's magic in this. Get connected.
Yes, I love that. And I think that's one of the beautiful aspects of Sigma is being able to connect with other nurses around the globe. So I want to thank you for your wonderful information that you shared with us today. Sigma is grateful that you took the time to share with our audience, and we look forward to hearing more from you in the future. We hope that you've enjoyed this webinar. As a reminder, 1 week from today, we will email you a link to the evaluation for you to obtain your Nursing Continuing Professional Development Certificate. Be sure to check out Sigma's upcoming webinars and other resources to support you and your colleagues at sigmanursing.org. Thank you for joining us today and have a wonderful day.